Welcome back. We're continuing our coverage of health care reform. It's been 13 months in the making as far as President Obama and the Democrats are concerned. They seem to be on the verge of getting it passed. That magic number of 216 clearly in sight now that Bart Stupak and other Democrats in the House of Representatives who oppose abortion say they will vote for the Senate bill and the subsequent reconciliation bill that's designed to change some of that Senate language. Let's bring in Republican Congresswoman Marsha Blackburn of Tennessee. She's a very, very outspoken opponent of the Democrats' health care bill. It looks like the Democrats, Congresswoman, have the votes to get it past the House today. Do you still have any hope that you can stop it?
Well, I tell you, until those votes go up on the board, I can tell you we're going to be working to do our best to defeat this bill. I think that you can look at what has transpired through this process. You just laid out the number of months that they have been working on a piece of legislation that they felt like they could get passed. And indeed, look at all the horse trading and the deal making and the backroom deals, and the list goes on of the machinations they've gone through in order to try to get to this bill. And Wolf, I think that you can see it's not a good bill, and they are determined to just ram this thing through, and it looks like they're going to call for their vote about 10 o'clock tonight.
How disappointed are you that these Bart Stupak Democrats and the others are now going to vote for it? Because it looked until at least a couple hours or so ago that they were going to vote against it, and that presumably would have made it so much more difficult for the Democrats to get to that 216 number.
You're right, and they were trying to get up to about 220 so that nobody was blamed for being the 216th vote. That's the politics of the situation. But I'm very disappointed that they have given in to an executive order and a colloquy and feel as if that is going to be something that will protect the unborn. Being someone who is pro-life, I was very disappointed to see that. I think it took a lot of courage for them to stand up against their leadership. And you know, here is the thing to look at. Yesterday, Congressman Skelton brought forward a bill that would protect our TRICARE, our men and women in uniform, about 9.4 million of them. That had to be passed in front of action on the Senate bill in order for them not to be taxed. Now, if you wanted to make certain that there was something ironclad and read into the law, that type action would have been necessary. I don't think that an executive order and a colloquy is going to stand up and protect the unborn and prohibit federal funding of abortions.
Congresswoman John King is here. He has a question for you as well.
Sure.
Two very different issues, but if you go back in time to all the Democrats coming to the floor of the House and the floor of the Senate late in the Bush administration saying the surge in Iraq would be a disaster, it was a reckless policy, it would be horrible. Some of them publicly and most of them privately now say, you know what, I was wrong and it worked out. If this passes and becomes law, will Republicans immediately try to repeal things? Or would you wait a year or two and say, let's give it a chance, even though I think it's not going to work, let's give it a test?
John, I think when you look at history and look at the test cases for public option health care, you don't see anybody from Tennessee, where we had TennCare, from Massachusetts, where they have the Commonwealth care, from Maine, or from New Jersey, where they passed guaranteed issue, going to the floor and saying, let me tell you how well this worked in my state. So history has shown that it does not work. Look at the National Health Service in Europe, in England. 60 years later, this has never worked like it was supposed to work. So our concern is that you don't have a model that you can point to and say, this has worked. It increases access, it gets down costs, it allows more competition, people have better quality of care. There is not a track record that you can point to and say, this is a good move.
So if there is a Speaker Boehner next January, do Republicans try to repeal the whole thing, or do you leave in place the new policies that would prohibit dumping somebody for a pre-existing condition, or denying them insurance, or kicking somebody off at insurance rolls if they develop a chronic disease and start costing the insurance company money? Would you try to ditch it all, or just pieces you don't like?
What you do is you implement patient-centered market force reforms that will deal with some of those components. And John, as you remember, some of those we have passed in the House with bipartisan support. We did it in '06. The Senate never got, Senator Frist was never able to get 60 votes for cloture. So what you do is go back and revisit making certain that those with pre-existing and chronic conditions have access, that you have some lower cost provisions, expanded HSAs or health savings accounts or association health plans, some of those items that have a proven track record that you know they're going to be able to address the issues the American people want to address, which is the cost, the coverage, the access, and the competition. And also, I will add, liability reform, and we passed that in the House in '06, sent it to the Senate. I think I've voted for it 3 different times since I've been here. It was done with bipartisan support each time. We have bipartisan support on these issues. Right now, there is only bipartisan opposition to the bill in front of us.
All right, Marsha Blackburn is a Republican from Tennessee. Congresswoman, thanks very much for coming in. We'll continue this conversation.
Always good to be with you, Wolf. Thank you.
Thank you. And we'll